Hey everybody, it's me, Fat Donnie. I know it's been a minute since I've done an update. I actually did one while I was driving in the car, but for some reason I can't transfer that video to my YouTube platform. So um, I don't even remember what I said in that video. Don't have time to go back and look at it. But I'm coming to you today because I just read from Susan G Komen that this is Black Family Cancer Awareness Week. And so I wanted to make a short little post, I guess, about what I think about this because, excuse me, I'm Black. I have a family, and too many of us have had cancer I'm aware of. So I wanted to speak on this because if you're Black or if not, but you have a family, I guess we need to be aware of the potential of cancer risk among members of our families. For me and my family, and for me personally, I am still recovering, I guess you would say, from breast cancer. I've had surgery. I was diagnosed early, DCIS, ductal carcinoma in situ, meaning it's in the milk ducts, or the cancerous cells were in the milk ducts. And so we were able to have surgery in November of 2024, radiation treatment in January of 2025. I'm on anastrozole medication for the next 5 years, maybe less, depending on how my body continues to respond to it. We'll have a mammogram in August of 2025 to make sure that all is still clear. So I consider myself a breast cancer survivor. My mother is a breast cancer survivor. I have an auntie who's a breast cancer survivor, but I also have several cousins who did not survive breast cancer. I have a grandfather who did not survive lung cancer. I have other uncles who did not survive their forms of cancer. I have some other cousins who did survive their forms of cancer. The list is just way too long. And it's in our family, it's in our Black family, our Black community in general, also. And Susan G. Komen again is having an awareness week to discuss issues. I think today their discussion is centered around caregiving for two women in particular whose husbands stepped in to help them through their breast cancer journey. the I'm not married, so I didn't. And my caregiver for my time after surgery, during radiation treatment, my caregiver happened to be my adult daughter, who's in her mid 20s. She stepped up to the plate. She really helped me out a lot. Um, because again, I guess if we want to talk about awareness and caregivers and helping our family members, when it comes to us Black women, we care for everyone else and we don't care for ourselves. And so, if you know of someone in your family who has been recently diagnosed with any form of cancer and is going through a treatment plan such as surgery, chemotherapy, radiation, medication, because even their side effects of medication can cause people to not be able to do their normal routines, such, a lot of medications cause fatigue, can cause some people to be physically sick, like vomiting, nausea, um, dizziness, fainting, weakness in their hands and feet, can't stand, can't hold things, can't walk as well. Um, excuse me. So even after the major treatments of chemotherapy, surgery, and radiation, the 5 year journey through the medication can also cause or create a need for cancer survivors or those who are fighting it, warriors, as we're often called while we're going through the journey. The warriors also need caregivers from time to time. Check in on them because they may not speak up. I'm speaking up right now just to say I'm okay. I don't have any side effects from my medication at this point. I did visit my oncologist. We have a three. No, we had a 3 month follow up. Now we're extended to 6 months. But she asked me, was I feeling any of the side effects like the fatigue? Well, I have hypothyroidism. I have slight anemia. I have all kinds of other things that also affect um, fatigue, my fatigue level, my energy level. So I told her I don't feel anything different than normal. um, and my normal is I push through it, because I have so much to do. Um, I'm going to slow down as soon as I can so that I can listen to my body more. But right now, um, I think I'm fine with my medication. But again, others may not be and may need some assistance. So listen, uh, or pay attention, be aware of what they're going through, how they're acting and reacting. Um, Yeah, I just thought about something. So yeah, and sometimes the mental, not sometimes, all the time, at least from my perspective, I think for sure, anyone who's had a diagnosis of cancer is going to have an effect on their mental health as well. Maybe some for a very short period of time, some for an extended period of time. But in my personal observation and opinion, based on myself and others around me, I do believe that that's also a major issue, or can be for some a major issue in the recovery process. So check on their mental state of being as well. Offer whatever support you can, um, as often as you can, and speak up, because they won't speak up generally when they have a need. So just wanted to throw that out there for the week of Black Family Cancer Awareness. Um, if you're Black and you have a family, just check in on everyone. I thank you for listening. If you have any comments, questions, or concerns for me, please leave them below and I will respond. You have a blessed day.